When significant amounts of protein are found in urine, it's called proteinuria. In our previous video, we explained extensively the major causes and symptoms of proteinuria. In case you haven't watched that video, we'll provide a summary here. Normally, adult urine protein levels are less than 150 milligrams after collecting the urine for 24 hours. Levels between 150 and 500 milligrams are considered moderate proteinuria. Severe proteinuria occurs when protein levels reach more than 500 milligrams. When diving into this topic, you might see the terms proteinuria and albuminuria used interchangeably, but they actually mean different things. Proteinuria means there is too much protein of any kind in the urine. Albuminuria is when the urine specifically contains too much albumin, the most common protein found in blood. Often, there are no symptoms with proteinuria, but in some cases, the urine may look frothy and the person may develop swelling or edema. Urine protein levels can temporarily increase after exercise or illness. However, if they persist, it could indicate kidney disease, and reducing proteinuria can help protect your kidneys from further damage. To lower protein in the urine, we need to treat its root cause, which is often kidney disease. Triggers for kidney disease include high blood pressure, high blood sugar, and high blood cholesterol levels. The increased force from high blood pressure injures the filtering units of the kidneys, causing proteins to leak into the urine. Elevated blood sugar from diabetes can damage small blood vessels in the kidneys, which then affects the filters and leads to protein loss. Additionally, cholesterol can form plaques along the artery walls, blocking blood flow to the kidneys, which impairs their function and also causes proteinuria. This is why keeping blood pressure, blood sugar, and blood cholesterol levels in check is important to prevent kidney damage. In our previous video, we suggested the top foods to help stop proteinuria. Today, we'll continue with the top drinks that can benefit your kidneys, backed by scientific studies. You'll also get practical tips for adding these drinks to your diet to support kidney health. Before we dive in, please note all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Now, let's return to the top drinks to help stop proteinuria. 9. Berry smoothie. This smoothie is a mix of berries and other kidney-friendly fruits, blended to make a drink that supports kidney health. Each berry type has its unique value, offering various kidney benefits, especially for proteinuria. For example, strawberries are rich in antioxidants like anthocyanins. They help to counteract the effects of oxidative stress and inflammation in the body. By reducing these kidney-damaging factors, antioxidants from strawberries can promote the health of kidney cells. Additionally, certain nutrients in strawberries help lower cholesterol levels. This has the potential to reduce and prevent the buildup of plaques in blood vessels that obstruct blood flow to the kidneys. Blueberries are another kidney-friendly option. Like strawberries, they are rich in antioxidants, such as anthocyanins. A 2004 study found that a cup of cultivated blueberries provides 9,019 antioxidants, while wild, or low bush, blueberries are packed with 13,427 antioxidants per cup. Blueberries have been shown to lower cholesterol levels. That's because berries are high in fiber, which helps remove cholesterol from the blood by promoting its excretion from the body in the form of bile. Next, honeysuckle berries may help filter out heavy metals and drug toxins, which can reduce strain on the kidney filtration system. Moreover, the anthocyanins in honeysuckle berries can help improve blood flow and reduce inflammation, which can greatly benefit the kidneys. Another popular kidney-friendly berry is acai berries, which are often bought frozen for use in smoothies. These berries are also rich in antioxidants, which help prevent damage to cells. Try the Very Berry Smoothie for your kidney health. This is a refreshing blend of pineapple, banana, and berries. You can mix them to your taste, with each serving containing about 2 cups of fruit. When buying berries for your smoothie, go organic. Some berries have high pesticide levels, according to the Environmental Working Group. Try to look for products labeled Integrated Pest Management, or IPM for short. They use a variety of pest management techniques, and chemical pesticides are only adopted when other methods fail to protect the plant. Better still, you can find organic berries because organic farming does not use harmful pesticides that can negatively impact the kidneys. If you buy non-organic berries, soak them in lemon juice or filtered water with baking soda to remove residues. Also, note that acai berries are often available as powder, frozen puree, or juice because they spoil quickly. It's best to read the label to see if there's extra salt or sugar. Remember, dried berries aren't equivalent to putting fresh ones in your smoothies. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 8. Turmeric milk. Turmeric, a spice from the ginger family, originates from southern India and Indonesia. Ayurvedic and traditional Chinese medicine have long incorporated this spice in their therapies. Curcumin is the active component of turmeric and can help with proteinuria. It does this by stopping the actions of chemicals in the body called cytokines, which cause inflammation that can harm the kidneys. Inflammation can damage the filtering system, letting proteins leak into the urine. By blocking cytokines, curcumin helps protect kidney cells and lessens proteinuria. Curcumin also helps protect your kidneys from the negative impact of high blood sugar. A 2012 study in Nutrition and Health also suggests that consuming turmeric may help protect against kidney damage caused by oxidative stress. In this study, researchers gave rats gentamicin, a drug known to induce kidney damage in high doses. One group of rats was given turmeric and ginger prior to the drug. After analyzing the markers of kidney damage in these rats, they found that turmeric and ginger significantly protected the kidneys from damage caused by gentamicin and reduced oxidative stress. In a review article published in 2022 in the Iranian Journal of Kidney Diseases, researchers analyzed how oral turmeric supplements affected proteinuria in patients with chronic kidney disease, or CKD for short. They found that curcumin supplementation led to a notable decrease in proteinuria in those taking it compared to those not taking it. This suggests that turmeric could be a helpful treatment for these patients. Making turmeric milk, or golden milk, is a simple and tasty way to consume more of the spice while supporting your kidney health. Just mix 1 to 2 teaspoons of turmeric with warm milk, black pepper, cinnamon, and honey or maple syrup. Heat it gently for about 10 minutes. Black pepper helps your body absorb curcumin. Plus, adding turmeric to meals containing oil can also help your body absorb curcumin more effectively. Using this spice to flavor your smoothie or soup is also a great way to enjoy its kidney-boosting benefits. Turmeric and regular curcumin supplements are considered generally safe when used as directed. However, during pregnancy and breastfeeding, you should avoid consuming large amounts of turmeric beyond what's normally found in food. It's best to ask your doctor how to take turmeric or any other supplements appropriately for your individual health concerns. 7. Pomegranate juice. Pomegranates have 3 times more antioxidants than green tea. This amount is great for fighting inflammation that worsens proteinuria. Plus, this fruit contains many kidney-friendly nutrients like vitamin K. 1 cup of pomegranate arils contains 28.6 micrograms of vitamin K. And the recommended daily value for adults is 120 micrograms. CKD often leads to vitamin K deficiency, which can cause heart and bone problems. Low vitamin K levels also seem to worsen CKD and its symptoms, like proteinuria. So, eating more vitamin K-rich food, like pomegranate, can be very beneficial for your kidneys. In a 2024 study published in the Journal of Nutrition and Food Security, researchers investigated the impact of pomegranate juice on kidney damage induced by lithium in rats. They discovered that giving pomegranate juice along with the lithium to one group of rats lowered their blood creatinine levels, which demonstrated less kidney damage than in those given lithium alone. Also, the group's blood urea levels went down, showing that pomegranate helps protect kidneys from lithium poisoning. This kidney-protecting effect may come from pomegranate's antioxidants, such as vitamin C and E, anthocyanins, punicalagin, ellagic acid, and gallic acid. These antioxidants have been shown to help protect the kidneys from damage caused by oxidative stress and harmful substances, such as heavy metals. Plus, antioxidants have beneficial effects on the cardiovascular system, including lowering blood pressure, which helps protect kidney function. The high levels of natural potassium in pomegranate may also help regulate blood pressure. But keep in mind, too much potassium is not good for some people with CKD, so make sure to clear this with your doctor. We will mention this again in detail at the end of this video. The ability of pomegranate to lower blood pressure has already been established, although the reductions are minimal. In 2017, researchers reviewed 8 clinical trials to determine if drinking pomegranate juice can help lower blood pressure. The analysis showed that, on average, systolic blood pressure and diastolic blood pressure, the upper and lower numbers of blood pressure readings dropped by 4.96 millimeters of mercury and 2.01 millimeters of mercury, respectively. A more recent review analysis in 2024 showed similar but more substantial reductions. Now, if you want to drink more pomegranate juice for kidney health, note that juice from the fresh fruit is always better than the bottled version. Making your own juice can save you from consuming the extra sugar and additives often included in the bottling process, which can be harmful to your overall health. Pomegranates have a naturally balanced sweet and tangy taste themselves, so you don't need extra sugar to enjoy their benefits. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Lemon water. Lemons are also rich in kidney-friendly vitamins and minerals. First, lemon contains potassium, a mineral that helps regulate blood pressure by balancing the amount of sodium in the body. This can help protect the kidney's filtering units and reduce protein leakage into the urine. Moreover, drinking lemon juice can help improve digestion and overall metabolic health, potentially helping regulate blood glucose. This is great because maintaining stable blood sugar levels reduces the risk of diabetes, a common cause of kidney damage, and subsequent protein loss. Also, many phytonutrients in lemons work as antioxidants to protect kidney cells from damage caused by oxidative stress. Plus, the antioxidants in lemon, particularly vitamin C, can help repair cell injuries and improve blood cholesterol levels. Furthermore, this citrus fruit helps increase citrate intake. Animal studies revealed that citrate decreased proteinuria in diabetic rats. Additionally, it is known that citrate binds to calcium in the digestive tract, reducing the amount that enters the bloodstream and preventing the formation of calcium oxalate crystals, a common component of kidney stones. While kidney stones do not directly cause proteinuria, preventing kidney stones can improve kidney health overall and help in the management of proteinuria. Lemons can be used in many ways. Some recommend squeezing 1 lemon into a glass of 150 milliliters water every morning before going to the bathroom. You can also zest the peel for baking or cooking to get its extra benefits. Drinking lemon juice to manage proteinuria is also considered safe for expecting mothers. Don't worry about enamel damage. The diluted lemon water is okay, unless you drink it too much or too often. But for a safer approach, sip your lemon water using a straw and then rinse your mouth with water. For your best cup of lemon water, choose firm lemons that appear bright yellow and have shiny, thin skin. Heavier lemons usually have more juice and flavor. Thin-skinned lemons tend to be juicier, while coarse, thick-skinned, and lighter lemons have less juice. For more juice, use lemons at room temperature. Try freezing lemon juice so you always have fresh juice on hand for cooking while ensuring it stays nutritious. 5. Cucumber juice. For a long time, cucumber has been used in traditional medicine to treat headaches and constipation. This vegetable might also help with proteinuria, which often comes with swelling as a symptom. Also, cucumber has been valued for its soluble fiber and water content with minimal calories and sugar, all of which help your body's attempts to regulate blood sugar. This crunchy veggie contains various antioxidants, such as cucurbitacins, beta-carotene, opiginin, and quercetin. In a 2024 study, researchers suggested that a mix of cucumber, citrus, and glycerol extract could be a good alternative to synthetic drugs for fighting inflammation and oxidative stress. Plus, cucumber aids in body cleansing by removing accumulated waste and toxins. This may help ease the stress on your kidneys from having to filter waste, leaving more energy for their other functions. Moreover, cucumber has an alkaline nature. This may help the body's efforts to balance the pH levels, keeping the blood pH within the normal range. As we get older, our kidneys might not work as well, and the blood tends to be more acidic. Too much acidity might play a role in the development of weaker bones, high blood pressure, heart disease, and memory problems. Plus, cucumber is known as a natural mild diuretic, and diuretics have been shown to reduce proteinuria. A 2021 animal study published in Folia Medica, Indonesiana, investigated the diuretic properties of different parts of cucumber compared with the diuretic drug furosemide. Scientists gave the mice cucumber extract from the flesh, or rind. The extracts had similar effects to the diuretic action of furosemide. Additional diuretic properties were seen when the entire fruit was used. Also, cucumbers are about 95% water, which helps keep you hydrated and keep your blood pressure in check. Water-rich foods like cucumbers also provide vital nutrients for repairing and strengthening our cells, including kidney cells. Adding cucumbers to juices or smoothies is a tasty way to enjoy them and to preserve their kidney-friendly nutrients. Try enhancing your cucumber juice with ginger slices, kale, celery, lemon, apples, or pineapples. They add a refreshing taste and offer antioxidant benefits for your kidneys. When shopping for cucumbers, try to pick slender, firm ones. The color should be medium to dark green for the best taste. Yellow spots mean they're overripe. 4. Beetroot juice. Beetroot is rich in potent antioxidants, such as betalains, vitamin C, and B, and nitrates. Betalains, the major active compound in beetroot, are protective against kidney injury and the effects of high blood pressure. Both are known causes of proteinuria, as we mentioned before. Also, beetroot has demonstrated positive effects for people with CKD, including reducing blood pressure, decreasing inflammation, and reducing oxidative stress. Therefore, consuming beetroot can be considered a therapeutic strategy to support CKD treatment. In a 2015 study published in the journal Hypertension, patients with high blood pressure drank 250 milliliters of beetroot juice daily. After 4 weeks, their blood pressure returned to normal levels. This effect was found to be due to the high levels of inorganic nitrate found in beetroot, which helps widen blood vessels. Before you buy beets to make juice, here are some shopping tips. First, look for roots that have a good ruby color and are firm. It's best to choose a beetroot that is medium-sized and round in shape. Try to select beetroots that have a small top and tail and bright green tops if still attached. You can use the leaves in salads, so nothing goes to waste. If you don't like the flavor of beets, try adding some lemon. It also makes a kidney-friendly juice. The ratio is up to you, but a good start is 2 beetroots and 1 lemon. Note that beetroot is also high in potassium. So if you have kidney disease, it's important to consult your doctor about the need to limit beetroot in your diet. 3. Ginger tea. Ginger has been widely used to ease nausea and vomiting. Studies on the therapeutic actions of this herb have demonstrated its powerful anti-inflammatory and antioxidant effects. Ginger has also been shown to protect the kidneys and reduce proteinuria. A recent comprehensive review of the evidence in human studies found that ginger has shown promise in managing type 2 diabetes, obesity, and arthritis. These conditions promote inflammation or high blood sugar, the 2 common causes of protein leakage into urine. In a 2015 clinical trial published in Nutrition, the researchers analyzed the effects of ginger on blood sugar in 36 patients undergoing peritoneal dialysis. These patients were randomly assigned to consume either 1 gram per day of ginger or a placebo for 10 weeks. At the end of week 10, the group taking ginger showed up to a 20% decrease in fasting blood sugar levels compared to their baseline readings, which was a significant difference from the reductions seen in the placebo group. Ginger has also been shown to improve blood lipid levels and have favorable effects on blood pressure. This pungent spice contains potent antioxidants, including gingerol, shogalls, and zingerone, with cooking, that work to reduce oxidative stress. In a 2019 study published in the Saudi Journal of Biological Sciences, researchers investigated the effects of ginger extract on cadmium-induced kidney toxicity in rats. Cadmium is a heavy metal that causes kidney dysfunction, tissue damage, and oxidative stress. After being intoxicated with cadmium, the rats were given ginger extract. This treatment significantly improved their kidney function and antioxidant status, suggesting ginger's protective effect against kidney toxicity. The end. Ginger tea is a perfect treat after dinner, but commercial ginger tea sometimes contains added sugars or additives. The tea in these tea bags also offers less antioxidant benefits due to processing, so it's better to choose fresh ginger. To make an even more kidney-friendly tea, add a little lemon or lime juice. Note that ginger beer isn't a kidney-friendly option, because it often contains a lot of added sugar. One source indicates 40 grams per 12-ounce serving, which is equivalent to 10 teaspoons. Also, ginger extract in supplements provide a much higher dose of active compounds than fresh ginger, which are thought to increase the risk of bleeding. Since the evidence is still unclear, be cautious about taking these if you are on blood thinners. Cranberry juice. Cranberry juice has a long-standing reputation for promoting urinary tract and kidney health. Initially, it was thought that cranberry acidified the urine, making it less hospitable to bacteria. Scientists later found that cranberries prevent bacteria from sticking to cell membranes of the urinary tract, potentially helping reduce the risk of UTIs. These effects are due to antioxidants, like anthocyanins and proanthocyanidins. Another great benefit of cranberries is their vitamin K content. Recent research suggests that vitamin K might help treat chronic kidney disease-related bone and heart disease, though the right dosage isn't clear yet. Still, getting natural vitamin K from cranberries is a good option for patients with kidney disease. Cranberries are also safe for patients with chronic kidney disease. Due to their low levels of potassium, phosphorus, and sodium. 1 cup, which is 110 grams, of cranberries provides only 1–2% of the recommended daily value for these minerals. When choosing cranberries for juicing, pick ones that feel firm and bouncy. Good cranberries should look slightly opaque and have a bright scarlet or fire engine red color. The brighter the hue, the riper and more beneficial they are. Remember not to wash cranberries before putting them in the fridge or freezer. Just rinse them well right before you use them. Some patients with chronic kidney disease might opt for cranberry juice as an alternative to water to reap its anti-inflammatory benefits. However, managing fluid and sugar intake is important for patients with CKD. Try to balance the amount of cranberry juice you drink with your overall fluid needs. So, be mindful of store-bought juice that can contain added sugar. It's best to ask your doctor to determine your optimal intake. 1. Green tea. Green tea is a widely popular drink made Camellia sinensis plant. In human studies, green tea supplementation has been shown to reduce overall cholesterol levels, blood sugar, and blood pressure. So, drinking this tea is like giving your kidneys a spa treatment. Unlike many other teas, green tea is made from raw and unprocessed leaves, meaning that it retains most of its natural antioxidants, like catechins, which are excellent at neutralizing free radicals and help reduce inflammation. Moreover, the polyphenol in green tea also help improve how your body uses insulin to manage blood sugar. In a 2019 review, researchers investigated the potential of a catechin type in green tea called -epigallocatechin 3 gallate, commonly known as EGCG. The evidence demonstrated that EGCG shows promise for treating or preventing acute and chronic kidney disease, kidney injury, nephrotoxicity, and kidney stones. However, most research in this area has been limited to animal studies. Therefore, further clinical trials are necessary to confirm green tea's kidney-protecting effects. Green tea and EGCG have also been tested for other potential metabolic health benefits. For diabetes and heart disease prevention, human studies show better results with 3 to 4 cups of tea. 600 to 900 milligrams of catechins daily. The optimal amount is still a matter of debate, but note that green tea does contain caffeine. Studies suggest that healthy adults can safely enjoy up to 400 milligrams of caffeine a day. One typical 8 ounces cup of green tea contains about 30 to 50 milligrams of caffeine, whereas the same amount of coffee has 80 to 100 milligrams. Which means you have to drink 8 to 13 cups to reach the limit. While that's a lot of tea, it's always best to enjoy your caffeinated drinks in moderation. Caffeine can stay in your body for up to 6 hours. So try not to have green tea late in the day. Instead, enjoy it in the morning for a nice energy boost. Green tea comes in many varieties, and choosing the high-quality ones is important for your kidney health. The simplest tip is to choose loose leaf tea instead of tea bags. Tea bags are often made from low-quality leaves, and processing can reduce polyphenol benefits. It's always smart to do some research on your own to check the tea's quality. Try to avoid green tea with very generic names, or with information that is too general. Usually, the more specific the name, the higher the quality. For instance, if you see the label green tea at the store, it's probably a low-quality green tea. Japanese green tea might be a bit better. And Gyokuro is likely even higher quality. Here is another tip for flavor. Consider the type of water you use. Water with a neutral pH is great for infusing green tea. Higher pH leads to the oxidation and degradation of catechins, while lower pH levels can reduce the tea's aroma. Also, to get the best flavor from your green tea, try using water with fewer minerals. Tea brewed in mineral-rich water can turn out stronger and more bitter in taste. Plus, mineral water tends to reduce the levels of volatile compounds that give green tea its distinctive flavor. Precautions. Curcumin is generally safe when taken at the recommended doses. However, long-term use can lead to peptic ulcers, stomach upset, and increased bleeding risk, particularly if taken with blood thinners. If you experience persistent stomach issues or are taking blood thinners, consult your doctor before drinking turmeric milk or consuming any product containing curcumin. Also, note that the acid from lemons can harm your tooth enamel, so dilute your lemon juice with water and try to avoid drinking it continuously. If you notice increased tooth sensitivity or enamel erosion, discuss these issues with your dentist. Another concern is that pomegranates and beetroots are rich in potassium, which can cause trouble for some people with kidney disease. Unhealthy kidneys may not filter potassium well, causing high potassium levels in the blood, which can lead to chest pain, difficulty breathing, kidney failure, or even cardiac arrest. The good news is that not all patients with kidney disease have to limit their potassium intake. In early CKD, higher potassium intake may even help slow disease progression, but these results are unclear for advanced stages. In addition, dialysis is specifically designed to filter potassium from your blood. If you are on certain types of dialysis treatments, you might need to consume more potassium instead of limiting it. So, before trying pomegranate or beetroot juice, consult your nephrologist or dietitian to determine the appropriate amount for your condition. Generally, people with kidney disease can still enjoy pomegranates and beetroots if their blood potassium levels are not high. Also, note that beets are high in oxalates, which can cause kidney stones. If you are at risk for kidney stones, enjoy beetroot juice in moderation. It's best to inform your healthcare provider about all drugs and supplements you are taking, plus any changes in your diet. They need to be aware of any alternative therapies you are using to prevent harmful interactions and ensure your safety. Proteinuria, an excess of protein in the urine, can signal underlying kidney disease often caused by chronic conditions such as diabetes and hypertension. Preventing proteinuria involves managing these underlying conditions medically and maintaining your overall kidney health through diet and lifestyle changes. Incorporating kidney-friendly drinks like turmeric milk, berry smoothies, lemon water, pomegranate juice, cucumber juice, beetroot juice, ginger tea, cranberry juice and green tea can support kidney function. These drinks contain antioxidants, anti-inflammatory properties, and other beneficial compounds that help reduce protein levels in urine and protect against further kidney damage. These drinks are generally safe, but if you have kidney disease or any other health issues, it's important to inform your doctor about any changes in your diet. Even small additions like new drinks to ensure they are safe for you. Now, We want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Everything we've discussed in this video might be wasted if you don't watch the video on the screen. Here, we share the worst 22 foods that can ruin your effort to heal proteinuria and kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed. Stay healthy. 7 common medications that can be harmful for your kidneys. We live in a time of medications. They help us somewhat, but they can also kill us silently. Now, as we age, our kidneys won't work as smoothly. It's important to keep them away from too many chemicals and medicines. But it's challenging because aging often brings a host of health issues and more pills to take. Certain medications can be nephrotoxic, meaning they can cause direct or indirect harm to the kidneys. As a result, the kidney's ability to filter blood diminishes, and harmful waste builds up, leading to serious health issues. Kidney damage severity is measured in stages, ranging from mild dysfunction to complete failure. The risk of kidney damage from drugs, or drug-induced nephrotoxicity, increases as you age and have kidney conditions. There are 2 main types of kidney damage from medications: dose-dependent toxicity and idiosyncratic toxicity. Dose-dependent toxicity means that damage increases with higher doses. In contrast, idiosyncratic toxicity is unpredictable and varies greatly between people. Sometimes, it's best to avoid these drugs altogether. Drug-induced nephrotoxicity can result from muscle tissue breakdown, or rhabdomyolysis, kidney tissue death, or renal infarction, and acid buildup, or renal tubular acidosis. This can result in decreased kidney function and other conditions like nephrotic syndrome or electrolyte imbalances. In this video, we'll explore the impact of common medications on kidney health and provide practical tips for managing these drugs safely. Remember, understanding the risks associated with them can empower you to make informed decisions about your health care. Stay tuned and learn how to protect your kidneys while effectively treating other medical conditions. Before we dive in, kindly note that all information you'll find in this video is produced by humans, and for humans. You can visit our website at healthtoday.com to see our advisory board and the team behind these videos. We do not use artificial intelligence writing tools like ChatGPT to automatically generate content. Be assured, our information is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Alright, it's time to swing back to the medications that can be harmful for your kidneys. 7. Antibiotics. Antibiotics are prescribed often, but they are not without risk. Does your doctor prescribe antibiotics for your sore throat, skin infection, or other infection? If so, it could be harming your kidneys. First, let's take a look at what antibiotics are. Antibiotics, also known as antibacterials or antimicrobials, are a group of medications designed to combat bacterial infections. They work either by killing bacteria or preventing them from reproducing. You can find common antibiotics with the brand names like Cipro, Augmentin, Flagyl, Bactrim, or amoxicillin. These drugs could be prescribed to treat strep throat, pneumonia, urinary tract infections, or UTIs in short, or skin infections. Antibiotics can treat these bacterial infections, but they can't treat viral infections, such as colds, flu, bronchitis, most coughs, and most sore throats. So, you should be extra cautious when your doctor prescribes antibiotics. If prescribed improperly, you might experience side effects such as diarrhea and liver and kidney problems. Even when properly used, some antibiotics such as polymyxins, aminoglycosides, and vancomycin can harm your kidneys. Simply put, your kidneys play a crucial role in removing antibiotics and other drugs from your body. But beware, antibiotics like polymyxins may damage kidney cell membranes, possibly causing kidney injury. Similarly, another antibiotic, aminoglycosides, can accumulate in kidney cells, causing cell death and harming kidney tubules. In general, the mechanism by which each antibiotic causes kidney injury is still not fully understood, but it might involve inflammation and harm to kidney cells. For antibiotics to be effective and safe for kidney health, it's important to use them correctly. Did you know that nearly 1/3 of antibiotics prescribed in the United States aren't even appropriate for the conditions being treated? That's according to a report from the Centers for Disease Control and Prevention, or CDC in short, in a study published in the Journal of the American Medical Association. Before you ask for an antibiotic or if your doctor prescribes one, knowing which conditions they can treat is important. You can ask them, "Is this necessary?" And most doctors will gladly explain why it's needed. If antibiotics are truly needed, follow the dosage exactly as instructed and adhere to any food requirements. Even if you feel better, never save antibiotics for future use or give your prescribed antibiotics to someone else, as prescriptions are tailored to individual health needs and conditions. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 6. Non-steroidal anti-inflammatory drugs, or NSAIDs in short. Some may not recognize non-steroidal anti-inflammatory drugs, but have you heard of ibuprofen, aspirin, Motrin, Ketorolac, Telecoxib, or naproxen? Yes, they're all NSAIDs, and you can purchase some of them without a prescription. In fact, NSAIDs are very common. Over 30 million people take them daily. NSAIDs are commonly used to ease headaches, sprains and strains, colds and flu. Pain from arthritis at their core. NSAIDs mainly work by blocking an enzyme called cyclooxygenase or COX in short. This enzyme helps produce pain-causing substances. However, COX is also important for protecting the kidneys during stress and helping regulate sodium and water excretion. So when NSAIDs block COX, it's a big reason why these drugs can harm your kidneys. In fact, all NSAIDs can cause acute kidney injury or AKI in short. Especially in older people, and when taken in high doses or over extended periods. This injury appears in two main ways. One because blood flow changes, and the other because of inflammation. Both caused by blocking COX. First, blocked COX can narrow kidney blood vessels, reducing blood flow. This can lead to fluid retention, high blood pressure, and even mild temporary kidney impairment. If this goes unchecked, it might cause more severe issues like acute tubular necrosis, where kidney tubules die due to lack of oxygen, and acute kidney failure. Even though this can initially look like acute kidney failure, it could eventually progress to chronic kidney disease. Second, although NSAIDs are anti-inflammatory drugs, prolonged use can trigger inflammation in kidney tubules, the tiny structures that filter waste. This inflammation is rare, but overall, kidney issues stemming from NSAIDs are a big concern, affecting 1% to 5% of daily users worldwide. This means that each year, around 500,000 to 2.5 million people experience kidney injury from NSAIDs. What's worse, these drugs are often involved in hospital admissions because of adverse drug events, some of which can be deadly. A 2006 study published in the Journal of the American Society of Nephrology analyzed data from over 184 people who were prescribed NSAIDs for various conditions. The results showed that NSAIDs use raised the risk of acute kidney injury by 26%, especially within the first 30 days of use. This result emphasizes the need for caution when prescribing and using these medications. In another study, scientists looked at 99 patients with chronic musculoskeletal pain who took NSAIDs for 12 months. They found that most patients' kidney function decreased after NSAIDs use but returned to normal after switching to another pain reliever drug. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Now, the next set of drugs on our list might surprise you, because they're typically considered pretty good for your kidneys. 5. Diuretics. Diuretics help with conditions like fluid retention or swelling, often seen in heart and kidney failure, and liver cirrhosis. Some diuretics are available over the counter, but prescription diuretics are typically stronger. Common diuretics include hydrochlorothiazide, or HCTZ, bumetanide, and Bumex, furosemide, sold as Lasix, spironolactone, found in aldactone, and acetazolamide and Diamox. They work by increasing urine output. They're also good for expelling excess salt and water through urine, which can help with hypertension or high blood pressure, a leading risk factor for kidney disease. Thus, diuretics are generally suitable for your kidneys. While diuretics are beneficial overall, they don't come without risks, especially concerning kidney health. In fact, they don't directly damage the kidneys or affect their filtering function like NSAIDs. Instead, they act further down the kidney's process, altering the urine's concentration and composition. This increases the amount of urine or changes the levels of electrolytes in it. So, excessive use or high doses of diuretics can lead to dehydration, a risk factor for kidney damage. A study looked at 131 patients using diuretics and having acute kidney injury from 1999 to 2010 at a hospital. At first, 96.2% of the patients already had at least one health issue before starting diuretics. With chronic kidney disease, or CKD in short, being the most common at 55%. They found that patients who used diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. The higher the dose, the bigger the risk. Also, about 27.5% of the cases of acute kidney injury were caused by diuretics alone, while others were due to a combination of diuretics and other drugs. So always consult your doctors before starting new medications with diuretics. For people with CKD who are taking diuretics, it's important to stay hydrated and regularly check for electrolytes and kidney function. Nowadays, there are more home testing options available than ever before. So people can now check their kidney function from the comfort of their own homes. 4. Proton pump inhibitors. Proton pump inhibitors, or PPIs in short, are widely used medications available over the counter. These drugs effectively treat conditions like gastroesophageal reflux disease, or GERD in short, or acid reflux by reducing stomach acid production. This is because PPIs target an enzyme in the stomach called hydrogen potassium ATPase, or proton pump, which is crucial for acid secretion. Although PPIs are generally safe and great at soothing acid-related discomforts such as heartburn, they still carry risks, particularly for kidney health. For example, PPIs have been linked with acute interstitial nephritis, or AIN in short, a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Even though only a tiny number of PPI users develop AIN, this drug has become a common cause of drug-induced AIN in developed countries. More concerning, AIN caused by PPIs often shows no apparent signs and often goes unnoticed. So, long-term PPI use may lead to lower kidney function and acute sudden kidney injury. Over time, this can even progress to CKD. An often overlooked side effect of long-term PPI use is low magnesium levels in the blood or hypomagnesemia, which is linked to CKD. Simply put, hypomagnesemia can disrupt your electrolyte balance and cause inflammation, triggering kidney disease. Low magnesium can also lead to other serious health problems, including muscle spasms, seizures, and irregular heartbeats. A 2019 cohort study in the Journal of Pharmacotherapy investigated the effects of PPIs on kidney function. This study checked how PPI use relates to new cases of acute kidney injury, or AKI in short, and chronic kidney disease in a large group of people. When they examined a group of 335 people, they found that those taking PPIs had a 4.35 times higher risk of AKI compared to those who didn't. Similarly, taking PPIs was linked to a higher risk of CKD. When researchers examined a group of 600 people, PPI users had a 1.2 times higher risk of CKD compared to non-users. So, people taking PPIs should have regular checkups to monitor their kidney function and magnesium levels. After all, don't let the solution to one problem become the source of another. While PPIs can provide significant relief from acid-related issues, long-term use of them can harm your kidneys and cause other problems, such as infections, fractures, or nutritional deficiencies. So, it's important to take PPIs for the shortest time possible to relieve acid-related issues without raising the risk of side effects. 3. ACE inhibitors. Angiotensin-converting enzyme, or ACE in short, inhibitors, are prescription medicines widely prescribed to lower blood pressure and manage conditions affecting the heart, blood vessels, and kidneys. Common ACE inhibitors are lisinopril, sold as Zestrel, Prinavil, Remipril, found in Altace, Enalapril, in Vasitec, and Benazepril, in Lotensin. These drugs work by blocking an enzyme that produces angiotensin II, which narrows blood vessels and increases blood pressure. By stopping this enzyme in its tracks, ACE inhibitors help relax blood vessels, thereby lowering blood pressure and reducing stress on the heart. Normally, ACE inhibitors also improve blood flow to the kidneys, easing the workload on these vital kidney-shaped organs. This enhanced blood flow can protect the kidneys, especially over the long term. Moreover, ACE inhibitors may help reduce the presence of protein in the urine, a common problem in chronic kidney conditions. In fact, ACE inhibitors are commonly recommended for people with kidney disease. While these medications boast protective benefits, they're not without risks when you mix them with NSAIDs and diuretics. Your risk of AKI can increase. Also, when you don't drink enough water to meet your body's needs, taking ACE inhibitors can put you at more risk of AKI. If you're concerned about your risk of AKI when taking these drugs, it's best to talk to your doctor about ways to lower it. Some people are concerned that ACE inhibitors might decrease your estimated glomerular filtration rate, or EGFR. Typically, a higher EGFR suggests better kidney function. However, ACE inhibitors reduce EGFR by relieving pressure on the kidneys, allowing the small filters, called glomeruli, to relax. While this may cause a slight decline in EGFR, it doesn't indicate kidney trouble. It simply means the kidneys are relaxing. However, sometimes eGFR may drop too much. This is especially risky in patients with heart failure, chronic kidney disease, or blockage in both renal arteries, or bilateral renal artery. If this occurs, your doctor may adjust your dosage or stop the medicine temporarily to find the cause. Note that in rare cases, particularly in patients with conditions like heart failure or severe dehydration, ACE inhibitors can cause acute renal failure. However, once stopping the medication, most patients recover without lasting kidney damage, even after needing dialysis. So, patients with heart failure, diabetes, or CKD benefit from ACE inhibitors because they ease the strain on the kidneys and offer long-term kidney protection. However, dosages should be adjusted carefully, and kidney function should be regularly checked. 2. Antiviral drugs. Most viruses clear up without antiviral drugs, but doctors prescribe them for serious or long-lasting infectious diseases like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. These drugs can clear the flu and combat other viruses from your body. For a flu, two common antiviral drugs are oseltamivir, Tamiflu, and zanamivir, Relenza. In contrast, for chronic infections like HIV, hepatitis, and herpes, antivirals can't cure them completely, but they can ease symptoms and reduce their severity. Antiviral drugs offer many benefits in treating viral infections. Yet their potential to harm the kidneys cannot be overlooked. This risk, whether from direct toxicity or crystal buildup that can cause kidney stones, is a serious concern. Careful management and customized treatments are necessary, especially for people with existing kidney problems. Let's take, for example, remdesivir, a drug for emergency use in COVID-19 cases. Remdesivir contains a substance called SBCD, which is mainly removed from the body by the kidneys. In people with kidney issues, SBCD might build up and cause kidney toxicity. Some clinical trials have inconsistently reported a decrease in kidney function with remdesivir. Moreover, data from global databases showed a significant increase in cases of acute kidney failure associated with remdesivir compared to other COVID-19 drugs. However, there hasn't been enough large-scale clinical data to confirm whether remdesivir is safe or harmful for people with kidney issues. So further studies are necessary to provide clarity in this area. Besides remdesivir, the use of more effective antiviral drugs often leads to drug-induced acute kidney injury. Some antiviral drugs like cetofovir, adafovir, fosarnet, acyclovir, interferon, and tenofovir can directly cause cell death in kidney tubules by reducing blood flow or increasing toxins. This condition is called acute tubular necrosis. Additionally, the antiviral drug atazanavir can cause inflammation in the interstitial tissue of the kidneys, impairing kidney function. Also, acyclovir, indinavir, and foscarnet can cause crystals build up in the kidneys, blocking the kidney tubules. In contrast, some antiviral drugs like viride and foscarnet can help manage kidney damage, but they also pose a notable risk of kidney failure. Therefore, taking these drugs under close medical supervision is crucial to safeguard the kidneys. Also, to safely use antiviral drugs, never skip doses or inconsistently take them. This practice can lead to virus adaptation, making the antiviral less effective. This is called antiviral resistance. Also, note that antiviral drugs are only available with a prescription, so don't buy them online or from unofficial sources. 1. Lithium. Lithium is a prescription medication for mood stabilizing and certain mental illnesses. These mental problems include mania, where one feels highly excited, overactive or distracted, and bipolar disorder, which causes mood swings between extreme highs, also known as mania, and lows or depression. Some brand names of lithium are Priadil, Camcolit, Lisconum, and Leliquid. For over 60 years, these drugs have enhanced the lives of many individuals suffering from bipolar disorder. While lithium can be a lifeline for calming mood, its impact on the kidneys cannot be ignored. Long-term use of lithium can lead to some serious kidney issues, including both acute and chronic kidney disease, as well as kidney cysts. Early on, kidney damage from lithium might be reversible, but it could become permanent with time. The main issue with lithium use is a type of diabetes linked to kidney damage called nephrogenic diabetes insipidus. This isn't your typical diabetes caused by high blood sugar. In this condition, your kidneys can't respond properly to a hormone called antidiuretic hormone, or ADH, which controls fluid balance. The result? One may have excessive thirst and too many trips to the bathroom. In rare cases, long-term use of lithium can even lead to end-stage renal disease, or ESRD. Symptoms of kidney trouble from lithium include excessive urine output and thirst, frequent nighttime urination, and signs of dehydration like low blood pressure and fast heartbeat. In severe cases, it can cause changes in mental status. Moreover, lithium can make the kidneys excrete too much sodium, a condition known as hyponatremia. Sudden hyponatremia, where sodium levels drop quickly in less than 48 hours, can cause serious problems if not treated, including life-threatening muscle breakdown, rhabdomyolysis, severe confusion, seizures, coma, and even death. So, patients should maintain a regular diet with enough salt and fluids while taking lithium. Moreover, when on lithium, it's important to define a suitable dosage. Get yearly blood tests to check creatinine levels and seek medical help if anything seems wrong. Lithium can harm you in many ways, not just by damaging kidneys. So, before starting it, let your doctor know if you have kidney, heart, thyroid, or breathing problems. Addison's disease or Brugada syndrome, extra tips for cautious use. Do you suspect that your medication is affecting your kidney health? It's important to seek medical advice right away. Symptoms of kidney failure might not be apparent initially, but as the condition worsens, signs such as decreased urine output, swelling in the legs, shortness of breath, and severe fatigue become more evident. If untreated, the consequences can be life-threatening. Let's ensure you remember these symptoms to know when to act. If you are taking any of the medications that have been discussed in this video, check your kidney function regularly using tests that include blood creatinine levels, glomerular filtration rate, or GFR in short, and urine tests for protein. Proper hydration helps your kidneys clear sodium, urea, and toxins from the body, which can mitigate the impact of nephrotoxic drugs. Be aware of potential interactions between your prescriptions that could impact your kidney health. Share all your current medications with any healthcare provider who prescribes a new drug. Yes, medications are essential for treating various medical conditions. Yet certain drugs pose significant risks to kidney health and should be used cautiously, especially in individuals with existing kidney disease or those predisposed to kidney disease. Antibiotics, NSAIDs, diuretics, proton pump inhibitors, ACE inhibitors, antiviral drugs, and lithium all have the potential to impair kidney function through mechanisms ranging from direct toxicity to effects on renal blood flow and electrolyte imbalances. For those with kidney disease, it is crucial to avoid or carefully manage the use of these medications. patients should work closely with healthcare providers to select treatments that minimize risk to the kidneys, adjust dosages as necessary, and monitor kidney function regularly. A healthy lifestyle can help you keep medication to a minimum. Try to eat a balanced diet with lean protein, fruits and vegetables, and exercise regularly to protect your kidneys from any damage. And if you're serious about mastering your kidney health and understanding how the body works, make sure you subscribe to us. Hit the bell icon and turn on all notifications so you never miss a life-saving video. If you enjoyed this video, we believe you'll enjoy the video on the screen. We share the worst 18 habits that may be harmful to your kidneys and tips to avoid them. See you there. Stay informed. Stay healthy. Online, you might find websites and YouTube channels discussing proteinuria as if it's a health condition on its own. However, it's essential to understand that proteinuria is a symptom of kidney disease characterized by an excess of protein in the urine. One may experience more frequent bathroom trips and foamy or bubbly urine, swelling or edema, shortness of breath, fatigue, nausea, vomiting, loss of appetite, nighttime muscle cramps, and puffy eyes can also occur. Having proteinuria can be a sign of hypertension and, in severe cases, heart disease. Proteinuria may be temporary or persistent. Temporary proteinuria means there is only temporary damage to the kidney due to a sudden kidney injury, such as from a kidney infection or intense exercise and dehydration. This video will focus more on persistent proteinuria that is often due to chronic conditions and can last months or years. Addressing the root cause of proteinuria is crucial for those experiencing it. Understanding why there is an excess of protein in your urine enables you to take appropriate and safe measures to address it. Let's delve into how your kidneys function. Each kidney contains about 1 million tiny filters called nephrons. And each nephron includes a glomerulus, totaling over 1 million glomeruli per kidney. Glomeruli work like kitchen strainers, filtering waste and extra water from the blood while keeping the protein and blood cells your body needs. After the initial filtration by the glomeruli, the filtered fluid flows through the kidney tubules. These tubules reabsorb small proteins and keep them in your blood while passing waste products into urine. So, normally your urine has almost no protein. However, if glomeruli are damaged, proteins can leak into the urine. The amount of protein leaked may be too high for the tubules to reabsorb. Then, protein is excreted in the urine, or proteinuria occurs. This is problematic because proteins should remain in the blood. Reducing protein in the urine is crucial for maintaining kidney health and overall well-being. Now, let's talk about solutions. Since proteinuria isn't a specific disease, treatment should focus on its root cause, kidney disease. High blood pressure, high blood sugar levels, and high blood cholesterol are primary contributors to kidney disease. When kidney disease arises, the nephrons or glomeruli fail to retain protein within the body. High blood pressure forces blood into the kidneys with such intensity that it damages the glomeruli's walls. This pressure thickens these walls, impairing their filtering ability and causing the protein to leak into the urine. Therefore, managing high blood pressure is vital for reducing protein loss in urine. Another major cause of proteinuria is high blood sugar, or diabetes, which damages the small blood vessels in the kidneys, preventing the glomeruli from filtering blood properly. High blood sugar levels overwork the kidneys, leading to damage and protein leakage. Thus, regulating blood sugar levels is essential for managing protein loss in urine. Cholesterol levels also play a role. Excess cholesterol can cause fat buildup and blockages in arteries, narrowing blood vessels, including those supplying the kidneys. The kidneys, which receive about 20% of the heart's blood output, need proper blood flow to function effectively. Blockages from high cholesterol can disrupt this flow, leading to kidney function loss and tissue damage, manifesting as abnormal protein excretion in urine. Managing persistent proteinuria starts with lifestyle changes, such as reducing salt intake to lower blood pressure, increasing fiber intake to manage blood sugar and cholesterol, and quitting smoking and tobacco use. In essence, improving kidney function is key to stopping protein loss in urine. And we are here to provide you with essential information on this journey. From this video, you will learn how to manage proteinuria with foods that possess kidney healing properties, helping to manage or prevent high blood pressure, blood sugar, and cholesterol. 6. Red bell peppers. Bell peppers, also known as capsicum peppers, are actually a type of fruit classified as berries. Red bell peppers have the potential to reduce blood sugar levels and blood pressure, helping to alleviate or prevent proteinuria. This fruit is also rich in antioxidants and fiber, while being low in potassium, phosphorus, and sodium, making it suitable for people with kidney disease. For example, red bell peppers get their red color from anthocyanins, natural antioxidants that may protect both brain and kidney cells. Moreover, red bell peppers are packed with vitamins and minerals, have no unhealthy fats, and are low in calories, all good for your kidneys. So, eating more red bell peppers can help with proteinuria by improving kidney function. 1 cup of chopped red bell pepper has only 46 calories and provides 3 grams of fiber, supporting digestion and reducing the strain on your kidneys. Plus, this amount gives you 317% of the vitamin C and 93% of the vitamin A you need each day. These vitamins are powerful antioxidants that help fight oxidative stress in your body, including your kidneys. For instance, vitamin C can help fight cancer-causing free radicals, and vitamin A can boost the immune system. So, eating red bell peppers is an excellent way to stop proteins secreted into urine by providing you with many essential and kidney-friendly nutrients without consuming many calories. Now, if you want to eat more red bell peppers to support kidney health and stop or prevent proteinuria, choose bell peppers with vibrant colors and a glossy shine. Their skin should be smooth, and the color should be consistent all over. Look for peppers that feel firm and have a nice weight. Unlike other peppers, red bell peppers aren't spicy because they contain no capsaicin. Red bell peppers have a mildly sweet, veggie-like flavor that works well in various dishes. For pasta, you can roast red peppers and add them to cream-based sauces, low-sodium cheese or cottage cheese, which are kidney-friendly. For salads, cut them into long slivers or bite-sized chunks to add extra color, crunch, and sweetness. As a snack, you can make roasted red pepper hummus or add sliced red bell peppers to a veggie tray. In soups, try dicing, sautéing, and then adding them to elevate your soup. Also, bell peppers pair nicely with the next food on our list for a kidney-friendly diet. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 5. Quinoa. Quinoa, a pseudo-cereal native to the Andean region, is rich in protein, fiber, minerals, vitamins, and healthy fats. These all are good for your kidneys, which might in turn ease or prevent protein leakage in urine. Plus, quinoa is a gluten-free grain that provides plenty of nutrients. Its essential amino acids and polyphenol also contribute to its kidney-friendly nutrients. Quinoa also helps fight inflammation and may even help prevent cancer. When one has proteinuria, they lose protein in their urine. so they must consume high-quality protein sources like quinoa. Quinoa is a complete protein containing all 9 essential amino acids. Its balanced amino acids, high fiber content, and low levels of harmful compounds often found in grains and legumes, such as phytic acid and lectin, promote better digestion and absorption. This can further reduce the strain on your kidneys and assist in managing proteinuria. Furthermore, the compound hydrolysate in red quinoa can help with proteinuria by reducing oxidative stress and high blood pressure. In a 2023 study published in Antioxidants, which involves hypertension rats, hydrolysate administration reduced oxidative stress and enhanced cardiovascular health, possibly stopping proteinuria. Also, rats treated with hydrolysate from red quinoa had higher antioxidant levels in their kidneys and liver than the untreated rats. Treated rats also had fewer free radicals in their blood, kidneys, and heart. Plus, quinoa can reduce excessive protein in urine by helping control blood sugar and prevent diabetes. Simply put, quinoa is a good source of magnesium, a vital mineral often lacking in diets. Higher magnesium intake may lower the risk of type 2 diabetes. You'll usually find quinoa in the grains or rice aisle of most grocery stores. It might be available in bulk bins, packaged bags, or boxes. Raw quinoa grains have a coating of saponin, a natural pest repellent that tastes really bitter. Not only can it ruin the taste of your quinoa, but it also can harm you. To avoid harm, quinoa under cold water to remove the saponin, but most strainers aren't fine enough to prevent the grains from spilling. It's much easier to buy pre-rinsed quinoa, which is clearly labeled and usually not more expensive. Quinoa can replace milk proteins and can be cooked by boiling it in water or broth until the liquid is absorbed, usually for about 15 to 20 minutes. Freezing quinoa is a great way to have it ready for quick meals. You can cook the quinoa as directed, then let it cool completely to prevent clumping when frozen. Next, place it in containers or bags and freeze. It will stay good for 2 to 3 months. While freezing keeps quinoa's kidney-friendly benefits, it might get a bit softer after thawing. This makes it perfect for casseroles, stir-fries, or soups, rather than using it as a standalone grain. Cabbage. Cabbage can help stop proteinuria by lowering your blood cholesterol. This leafy green vegetable is high in water, fiber, and antioxidants like phytosterols, which compete with bad cholesterol for absorption into the blood. This competition can lead to lower levels of blood's bad LDL cholesterol, reducing the risk of heart disease and complications affecting kidney function and causing more protein in urine. Furthermore, cabbage is packed with nutrients that can boost your immune system and promote digestive health, supporting kidney health and offering relief from proteinuria. Cabbage is also a storehouse of essential nutrients, including fiber, vitamins, such as C and K, minerals, and antioxidants. These nutrients support overall health, including kidney function. For example, cabbage is rich in vitamin C and sulfur, which help eliminate toxins like free radicals and uric acid from the kidneys. Removing them reduces harmful toxins that can damage kidney cells and trigger proteinuria. Also, the phytonutrients found in cabbage, such as indoles and glucosinolates, are particularly effective in helping your liver detoxify and eliminate toxins, thus reducing the workload on your kidneys. Moreover, anthocyanins in cabbage have also been shown to possess anti-inflammatory properties. Chronic inflammation is linked to various health conditions, including kidney diseases. By reducing inflammation, cabbage can help protect kidney health and manage proteinuria. Cabbage also helps with blood pressure due to its iron content. Iron can help increase red blood cells, improving circulation and blood pressure. Cabbage also contains anthocyanins, powerful antioxidants that relax arteries, helping prevent plaque buildup and lower blood pressure. Note that cabbage is a potassium-rich food, which is normally beneficial for maintaining healthy blood pressure levels. Potassium helps regulate blood pressure by counteracting the effects of sodium, thus reducing the risk of hypertension and related kidney issues, such as protein overflow in urine. However, if you have certain kidney issues, you may need to limit your potassium intake. We'll explain it in more detail in the next section. Available in various colors, shapes, and sizes, cabbage offers versatility in the kitchen, whether eaten raw in salads or stir-fried for a nutritious meal. It also features prominently in fermented foods like sauerkraut and kimchi, known for their gut-friendly properties. So, instead of just boiling or steaming, consider fermenting cabbage to make sauerkraut. Fermentation not only enhances the flavor, but also increases the availability of beneficial probiotics, which can aid digestion and potentially improve gut health. A healthy gut helps eliminate toxins and waste through stool, potentially easing the burden on your kidneys. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 3. Avocados. Avocados can help with proteinuria by improving your blood cholesterol. They stand out for being low in carbohydrates and high in antioxidants and healthy fats, mainly monounsaturated fats. Plus, this creamy fruit is packed with around 20 essential vitamins and minerals. This unique profile contributes to reducing LDL, bad cholesterol, and inflammation. As we mentioned before, these effects greatly benefit your kidney health and help ease proteinuria. Eating avocados regularly can help regulate blood sugar, further stopping proteinuria. Most fruits are high in natural sugars, but avocados are not very sweet. A whole avocado has less than 1.5 grams of sugar, while a medium apple has about 19 grams. Additionally, avocado's fiber content further helps lower blood sugar and supports gut health and satiety, which can help mitigate or prevent protein in urine. Plus, avocados, like most fruits, are low in phosphorus and sodium, making them suitable for people with kidney issues, including those with proteinuria. The limited intake of these minerals helps manage kidney function and prevent further complications. However, avocados are quite high in potassium. A single serving of avocado, roughly 1/3 of the fruit, provides about 250 milligrams of potassium. But as we discussed cabbage, potassium is an essential mineral that helps control blood pressure and supports heart health. Low potassium levels can raise blood pressure and increase the risk of protein secreted in urine. In some of our other videos, we mentioned that you may need to limit your potassium intake if you have certain kidney diseases. But having kidney disease doesn't always mean you need to limit potassium. It depends on the disease stage. So, it's important to incorporate avocados into your diet with careful consideration. For those with early-stage kidney disease or kidney transplant recipients who typically do not need to restrict potassium, avocados can be safely eaten in moderation. Moreover, people on daily home dialysis, nocturnal hemodialysis, or peritoneal dialysis may need more dietary potassium. This is because dialysis helps remove a significant amount of potassium from the blood. Those on hemodialysis 3 times a week may need lower potassium levels. In such cases, working closely with a kidney dietitian is crucial to determine the safe consumption of avocados based on individual dietary needs and treatment plans. Now, if you choose avocado for your diet, Note that the perfectly ripe avocado should be slightly firm but not too hard. If it's not ripe yet, but you're eager to eat it, you can speed up the ripening process by storing it in a paper bag on the counter until it softens when gently squeezed. If you need to store it for a few days, keep it in the fridge. However, don't submerge your avocado in water, which can lead to foodborne illness. Also, don't forget that eating too many avocados can cause weight gain because of their high fat content. Fats are digested slowly and make you feel full longer than other nutrients. So eating too much might lead to nutritional deficiencies. This is not good for your kidneys, and may worsen proteinuria, as your kidneys now don't get enough energy from foods to filter protein effectively. Besides avocados, avocado oil demonstrates promising potential in supporting kidney health. Avocado oil, rich in oleic acid and antioxidants, has been shown to enhance function and decrease oxidative stress within the kidney cells. Also, avocado oil intake can lower blood pressure, a significant factor in managing proteinuria. Plus, avocado oil improves vasodilation in the kidneys, which is essential for maintaining proper blood flow and preventing vascular dysfunction linked with protein in urine. Studies show that avocado oil supplementation reduced kidney damage in hypertensive rats by improving cell function and reducing oxidative stress in the kidneys. 2. Extra virgin olive oil. Extra virgin olive oil, or EVOO in short, is a type of olive oil obtained from olives using only mechanical methods, without solvents or refining. It is the highest quality and most flavorful olive oil available, characterized by its low acidity, usually below 0.8%, and superior taste and aroma. But now, how can EVOO help with stopping proteinuria? First, this popular oil is rich in monounsaturated fats, particularly oleic acid, as well as antioxidants, such as phenolic compounds, which contribute to its numerous health benefits. These benefits include reducing the risk of heart diseases, improving cholesterol levels, lowering blood pressure, and having anti-inflammatory and antioxidant properties. All these benefits help manage kidney disease and protein in the urine, as we mentioned in previous sections. Also, recently EVOO has been gaining attention due to its potential benefits in managing chronic kidney disease, or CKD. Rich in bioactive compounds like hydroxytyrosol, tyrosol, oleation, and oleocanthal, EVOO offers antioxidant and anti-inflammatory properties that may improve kidney function and reduce the risk of proteinuria. It's worth mentioning the EVOO's minor phenolic compound, 3,4-dihydroxyphenylglycol, or DHPG in short. DHPG offers antioxidant benefits, reduces harmful nitric compounds, and regulates prostacyclin production, a compound that helps prevent blood clotting and inflammation in blood vessels. These effects collectively reduce oxidative and nitrosative stress in animal studies, improving kidney function and structure, and potentially stopping proteinuria. A 2021 study in the International Journal of Molecular Sciences analyzed 3 different diets on rats for 24 weeks. The diets included a standard diet with virgin olive oil, and a standard diet with butter plus cholesterol. Rats fed the virgin olive oil diet had similar blood pressure to those on the standard diet, while rats on the butter plus cholesterol diet had significantly higher blood pressure. Additionally, the virgin olive oil diet influenced kidney enzyme activities related to blood pressure, suggesting a beneficial effect on blood pressure regulation through improved kidney function. All these results point toward EVOO's potential in easing proteinuria. EVOO is a staple of the Mediterranean diet and is widely used in cooking, salad dressings, dipping oils, marinades, and as condiments. EVOO is high in kidney-friendly antioxidants, but low in smoke points. Thus, avoid high-heat cooking to prevent burning. EVOO is normally good for sautéed dishes and baked goods. However, we still suggest using it for low to medium heat cooking to preserve more nutrients. Also, olive oil isn't ideal for prolonged or repeated heating. When buying olive oil, choose one stored in dark glass or metal containers. These materials help shield the oil from heat and light, which can affect its quality. However, even dark glass can't fully shield your oil from oxidation, so it's a good idea to cover your olive oil bottle with aluminum foil. To ensure you get high-quality olive oil, look for ones tested for purity and quality. Look for seals from the International Olive Council, or IOC, for internationally produced oils, and the North American Olive Oil Association for North American oils. California-produced olive oils may be certified by the California Olive Oil Council. Walnuts, packed with heart-healthy fats, omega-3s, fiber, and plant protein, offer potential improvements in kidney health and support stopping proteinuria. Plus, eating walnuts can help fight inflammation, provide antioxidants, and keep you feeling full longer thanks to their high-quality protein, fat, antioxidants, and fiber content. As we mentioned before, all these nutrients can greatly improve blood pressure, blood sugar, blood cholesterol, and yes, proteinuria. Plus, walnuts are typically eaten raw, giving them stronger antioxidant properties than roasted nuts. Antioxidants help prevent or reduce kidney-damaging oxidation. With moderate levels of phosphorus and potassium and low levels of oxalates, walnuts are a smart choice for managing proteinuria and overall well-being. Plus, walnuts are high in magnesium, which is great for kidney health. A 2023 review suggested that magnesium can be used to complement the treatment of chronic kidney disease and improve kidney function. When your kidney function improves, the risk of having proteinuria in the future will be reduced. In a 2019 study published in the Diabetes and Women's Health Study, researchers investigated the link between nut intake and kidney function among women with a history of gestational diabetes mellitus, or GDM in short. They analyzed data from 607 women with a history of gestational diabetes, focusing on 330 participants free of major chronic diseases. Results showed that women consuming nuts, such as walnuts weekly, had the lowest urinary albumin to create 9 ratio, or UACR. It suggests that there is less albumin, a protein, being leaked into the urine, indicating reduced proteinuria. Daily nut consumers also exhibited higher estimated glomerular rate, or eGFR values, compared to weekly consumers. Higher eGFR is another indicator that indicates better glomerular or kidney health. And we will deal with it in another video. This suggests moderate walnut consumption may benefit proteinuria, particularly among women with prior GDM. Plus, eating just 1 ounce of walnuts every day can lower your risk of heart disease and potentially reduce your risk of kidney issues like proteinuria. However, eating more than a handful or 2 of walnuts daily can add extra calories, potentially causing weight gain. So, it's important to be mindful of your portion size and avoid walnuts with added salt, sugar, or chocolate. They contain more sugars and calories that can put more strain on your kidneys. To keep walnuts tasting fresh, store them in a cool place. Warm temperatures can make walnuts go bad, causing them to smell and taste off. If they smell like paint thinner, they're rancid and should be thrown away. Rancid walnuts aren't good for your kidneys or overall health. So, when you bring walnuts home, it's best to store them in your fridge or freezer. Also, wait to chop or shell them until you're ready to use. This keeps the flavor fresh and prevents your walnuts from turning rancid. Still, note that while cold temperatures slow down spoilage, it's best to buy nuts in smaller amounts that we can eat quickly. Other causes of high protein in urine. Note that having a lot of protein in your urine doesn't always signal a kidney issue needing treatment. If you are doing too intense exercise or dehydrating, or if you are experiencing stress, pregnancy, or a poor diet, your urine protein levels can temporarily rise. So, it's important to check your diet, habits, and health conditions to understand why your urine protein levels might be high. Also, pregnant individuals with a history of preeclampsia should have regular checkups. Preeclampsia is a condition with high blood pressure and liver and kidney damage. It usually resolves after childbirth. However, monitoring is still essential. Your doctor might suggest further urine tests to monitor protein levels over time. If they stay high, it could indicate a real kidney disease. During healthcare visits, try to ask specific questions about the diagnosis, treatment plan, lifestyle adjustments, and potential alternative conditions. Also, working with a registered dietitian can help protect your kidneys and reduce proteinuria. They can assist you in planning meals to help you lose weight if needed, avoid high-sodium foods, and eat the right amounts and types of protein. To wrap it up, proteinuria, or having too much protein in your urine, can be a sign of kidney damage. The top 6 superfoods discussed: red bell peppers, quinoa, cabbage, avocados, extra virgin olive oil, and walnuts, offer promising avenues for managing proteinuria and supporting kidney health. Understanding the causes, symptoms, and proactive steps for prevention and management is crucial. Causes of proteinuria range from dehydration and excessive exercise to underlying kidney issues and conditions like diabetes. It's important to maintain a balanced diet, stay hydrated, manage underlying health conditions, and seek medical attention for persistent symptoms to actively prevent proteinuria. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Everything we've discussed in this video might be wasted if you don't watch the video on the screen. Here, we share the worst 22 foods that can ruin your effort to heal proteinuria and kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed. Stay healthy. Why am I urinating every 2 hours? Possible causes. Before we get into the causes, it's good to know that needing to pee every 2 hours can be normal for some people. As you get older, you will need to urinate more often, and it's normal to wake up occasionally during the night to urinate. For instance, in your 40s and 50s, waking up once a night to go to the bathroom is typical. In your 60s and 70s, it might be twice a night, and in your 80s and beyond, it could be 2 to 3 times. However, waking up too often at night to urinate, also known as nocturia, can disrupt your sleep and may indicate a health issue, such as heart disease, sleep disorder, and swelling. Sometimes, the increased urination frequency comes with kidney pain. By kidney pain, we mean that dull ache in your back, stomach area, or lateral sides. Kidney pain results from various diseases. Most of these diseases also result in frequent urination, or feeling the urge to urinate every 2 hours. But if you experience pain along with frequent urination, it may not always be kidney-related. Pain at the start or during urination points to a urethral issue, while pain after urination suggests problems in the bladder or prostate. These issues can be associated with kidney pain due to the close proximity of the bladder, prostate, and urethra to the kidneys. Whether you feel the pain or not, there are multiple reasons for frequent urination. These can be due to kidney or bladder problems or non-renal diseases. Now, let's see the possible causes of frequent urination. 1. Urinary tract infections, or UTIs in short. The urinary tract is the pathway from the kidneys to the urethra that moves urine from the inside to the outside of the body. It starts in the kidneys, where urine is formed, and then passes through the ureters to the bladder, where it's stored. Finally, urine is expelled from the body through the urethra. Infection of any part of the urinary tract is one of the most common reasons for frequent urination and is associated with pain. It can be kidney infection, also known as pyelonephritis, bladder infection, also known as cystitis, and urethra infection, also known as urethritis. To give you an idea, infection leads to inflammation, which can irritate the lining of the urinary tract, leading to a greater urge to urinate. Also, to flush out the bacteria causing the infection, your body may increase urine production. Other than frequent urination, other symptoms of UTIs are pain in the groin or lower abdomen, bloody or cloudy urine, pain while passing urine, also known as dysuria, nausea, fever, or chills. Are you enjoying our videos so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 2. Kidney diseases. If you think that you need to urinate more often, especially at night, also known as nocturia, this may indicate there's a problem with how your kidneys are filtering urine. More specifically, it can be related to an issue with the kidney's filtration system, and you may have a kidney disorder. Your kidneys are like the body's natural filters, helping to remove waste and excess fluids by creating urine. Normally, your kidneys do a great job of concentrating urine by reabsorbing water back into the bloodstream. However, if the kidneys get damaged, their ability to concentrate urine diminishes. This means they can't reabsorb water as effectively, leading to the production of larger volumes of dilute urine. This increased volume means that one needs to urinate more frequently. 3. Bladder issues. 3. Bladder issues. When you urinate frequently, it can sometimes be due to problems with the bladder. One common issue is the presence of stones in the bladder. These stones can cause several symptoms, including difficulty urinating, pain during urination, and lower abdominal pain. These symptoms can make it hard to fully empty your bladder, leading to a frequent urge to use the bathroom to pass urine. Another concerning issue is bladder pain syndrome, also known as interstitial cystitis. This is a chronic condition where people experience ongoing pain in the lower abdomen for weeks. This pain is often accompanied by a frequent need to urinate. The exact cause of this condition is not fully understood, but it may involve a defect in the immune system, similar to autoimmune disorders or allergic reactions. Sometimes, frequent urination can signify a more severe issue, such as bladder cancer. This cancer can also present with lower abdominal or back pain and blood in the urine. 4. Urethral stricture. The urethra is the last part of the urinary tract that is responsible for draining urine out of the body. Sometimes it can become narrow due to injuries or infections, and this condition is known as urethral stricture. This narrowing can lead to difficulty when urinating, often causing the need to run to urinate again and again because you cannot completely pass all the urine out in one go. The next reasons on our list might not be directly related to a urinary tract condition, but they can still be common and worrisome. 5. Prostate problems. Another common reason for needing to urinate more often is benign prostatic hyperplasia, or BPH in short, which affects the prostate gland in males. The gland, located just below the bladder, plays a role in producing semen, also known as male fluid containing sperm. As men age, it's common for this gland to get enlarged, producing urinary symptoms. The most common symptom of BPH is an increase in the frequency of urination and difficulty controlling or retaining urine. Simply put, an enlarged prostate can obstruct the flow of urine from the bladder, causing incomplete emptying, just like the case of urethral stricture, and consequently, frequent urination. Additionally, a prostate infection, also known as prostatitis, can cause you to feel the need to urinate frequently. This condition can also make urination painful. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Vaginal issues. We've discussed how infections in the urinary tract or prostate can lead to more frequent trips to the bathroom. Similarly, vaginal infections, also known as vaginitis, whether from bacteria or yeast, can also increase the need to urinate. Another possible cause is anterior vaginal prolapse, also known as sister seal. It is a condition where the bladder drops from its normal position and pushes against the front wall of the vagina. This happens because the pelvic floor muscles, which support the bladder and other pelvic organs, become weakened or stretched. Because the bladder is displaced and not fully supported, it can cause a sensation of needing to urinate more often. But why do sister seals occur? The common reasons for pelvic floor weakness and bladder displacement are chronic constipation, multiple childbirth, or heavy weightlifting. Besides causing recurrent urination, sister seals can also lead to pressure symptoms in the pelvis. 7. Pregnancy. As the baby grows during pregnancy, the uterus expands to accommodate the developing fetus. 7. Pregnancy. The bladder, which sits below the uterus, gets pressed upon by the growing uterus, which takes up more space. This pressure reduces the bladder's capacity to hold urine, resulting in an increased frequency of urination. 8. Neurological disorders. Our nervous system contains a network of nerves that regulate bladder function. These nerves normally communicate between the bladder and the spinal cord and brain, instructing the bladder muscles to contract or relax in order to store or release urine. However, conditions like neurological disorders, stroke, and spinal cord injuries disrupt these nerves. This disruption often results in frequent urination and loss of control in holding urine. 9. Diabetes. 9. Diabetes. Diabetes is a chronic condition where there is an excess of glucose in the bloodstream. We may all know that the kidneys play a crucial role in filtering blood. So, when there's excess glucose in the blood, the kidneys need to work harder to filter it out and excrete it through urine. That's why people with type 1 and type 2 diabetes urinate more frequently. Also, diabetes is a major cause of kidney damage. High blood sugar from diabetes can damage the kidney's small blood vessels, making it hard for the kidneys to filter properly. As we discussed earlier, kidney damage is a common cause of increasing the urge to urinate. 10. Medications. Some medicines involve increasing the urine output. Diuretics, which help with conditions like fluid retention or swelling, is an expelling example. These drugs help the kidneys remove excess water and salt from the body through urine, increasing the frequency of urination. Remember, some common medications can impact kidney health, such as NSAIDs for inflammation, antibiotics for infections, or PPIs for acid reflux. We can't cover all of them in this video, but you'll find a detailed explanation in the video on the screen. We also shared tips for using them safely. 11. your drinks. Sometimes, after a tough workout, sauna session, or a hot day out, you might find yourself drinking more than usual. If you end up needing to urinate more often during those times, don't worry. Your body and kidneys are doing their job well. Increased urination in this case simply means more fluid and equals more fluid out. Also, note that drinking alcohol and caffeine also increases the frequency of urination. However, there is no exact limit yet at which urinary frequency gets disturbed by these drinks. When to see your doctor. Earlier in the video, we mentioned that not every instance of frequent urination is cause for concern. However, there are some signs you should pay attention to. If frequent urination is accompanied by high fever and chills, seek medical help. It could indicate an infection. Also, don't ignore symptoms like one-sided pain, lower abdominal or back pain, painful urination, also known as dysuria, or blood in your urine, or hematuria, alongside frequent trips to the bathroom. And if you notice a vaginal or penile discharge, especially if it resembles pus, it is a clear sign to see your doctor. Some people may ask if seeing urine color would help to diagnose kidney disease. The answer is no, as damaged kidneys do not change the color of urine most of the time. However, when kidneys fail, urine could appear frothy or foamy due to the presence of protein. Foamy urine is also an early symptom of kidney disease, so be mindful of that. Other than this, there is no specific variation in the color of urine when the kidneys fail. If you can't pinpoint why you're urinating more often lately, like changes in how much you drink or drinks like alcohol or caffeine, it's also a good idea to talk to your doctor. This is especially important if it's affecting your sleep. During your visit, your doctor will ask about your fluid intake, medications you are taking, your drinking habits, if there is any swelling in your feet, for how long you have been experiencing this. And if you've experienced associated symptoms such as burning or pain when urinating, they might also ask about your history of fevers and whether you snore. It's good to think about these details before your appointment to help your doctor better understand your situation. Possible treatments for frequent urination. Once your doctor diagnoses your condition, they'll discuss possible treatment options with you. Just like with any symptom, the treatment for frequent urination will depend on what's causing it. For instance, urinary tract infections, or UTIs in short, are typically treated with antibiotics. And as the infection clears up, your urination frequency should return to normal. However, antibiotics can affect your kidneys, so it's wise to discuss your dosage with your doctor, and focus on eating more kidney-friendly foods, which we will mention later in this video. If bladder pain syndrome is the cause for your increased trip to the bathroom, opt for healthy lifestyle changes such as stress reduction, dietary changes, exercises, and bladder retraining techniques. Note that bladder cancer and urethral stricture require expert opinion to provide you relief and may involve surgical intervention in most cases. Now, benign prostatic hyperplasia, or BPH in short, can be treated with medications that ease obstruction. And refractory cases require surgical excision of enlarged prostatic tissue. If diabetes is the cause, it's important to properly manage your glucose intake. For anterior vaginal prolapse, Kegel exercises or pelvic floor exercises can be helpful. Also, frequent urination during pregnancy can be managed with pelvic floor exercises, high fiber intake, and limiting fluid after dinner. And before opting for any treatment, don't forget that fluid modification and tracking what kind of drinks you consume daily also help devise ways to reduce frequent urination. Home remedies for frequent urination. When it comes to home remedies, there's not much you can do to reduce frequent urination, except if it's due to your drinking habit. You can keep a diary to monitor the exact frequency of urination. This will also help find the cause. It's important to consult your doctor. But you can use some home remedies to support your treatment if you have any of the conditions we mentioned earlier. The best thing you can do is to cut down on caffeinated drinks, alcohol, and sodas. Also, try not to drink water a few hours before bedtime to avoid those late-night trips to the bathroom. Also, you can try bladder retraining techniques. These involve gradually trying to hold urine for increasing intervals, which will help build bladder capacity. Another suggested exercise is the pelvic floor exercises, which are particularly important for elderly women. It will strengthen the muscles of the bladder and its holding capacity, like the bladder retraining techniques. In case of frequent urination owing to UTIs, some simple home remedies to get rid of them are increased garlic intake, cranberry juice, and probiotics. Though more research is needed in this domain. Also, avoid citrus and acidic foods, which may irritate your bladder if you have an infection. How to prevent kidney diseases. Preventing kidney disease mostly comes down to making healthy lifestyle choices. It's important to keep yourself physically active, so try to do at least 30 minutes of exercise per day. If you are obese or overweight, aim to reduce weight to save yourself from a lot of diseases, including kidney diseases. Also, if you drink or smoke, try to cut back, and if you don't, it's best not to start. You should not drink more than 1 drink of alcohol per day if you are female and more than 2 drinks a day if you are a male. Try to seek help if you are having a hard time quitting smoking. One more important thing to prevent kidney disease is managing your other conditions. For example, hypertension, 120/80 millimeters of mercury, is one of the most common reasons for kidney damage. Get your blood pressure checked regularly and seek medical attention if found above the normal range. If it is in the normal range, some lifestyle tips can prevent it from getting higher, such as reducing salt intake, exercising, and dietary changes. Plus, managing your blood sugar levels is also important, as diabetes affects the kidneys a lot. Complying with your diabetes medicines, lifestyle modification, and regularly monitoring your blood sugar can save you from kidney diseases. It's best to avoid excessive use of over-the-counter painkillers or OTC analgesics. Painkillers, such as NSAIDs, can damage the blood vessels of the kidneys, so use them cautiously and ask your doctor about the quantity that is allowed for your disease or pain. Healthy food that protects your heart and kidneys include fresh fruits and vegetables, whole grains, fat-free dairy products. Try to 10% of your daily calories and limit sodium, which is abundant in salt, to less than 2.3 grams per day. You can use spices to replace salt, to add taste to your food, and try to bake or broil your meat instead of frying it. Water is the best drink for your kidneys. Water has 0 calories and is best for hydration and normal functioning of the body as well. To quench your thirst, try to prefer water over anything else, particularly when you're at risk of having a kidney disease. In this video, you learned frequent urination can be due to renal or non-renal diseases. Important causes of increased frequency of urination are urinary tract infections, or UTIs, benign prostatic hyperplasia, or BPH, bladder stones, urethral stricture, bladder cancer, diabetes, pregnancy, vaginal prolapse, and increased water intake. It is important to consult your doctor if you notice frequent urination with blood in urine, lower abdominal pain, fever, chills, or vomiting. Possible treatment of frequent urination depends upon its cause, such as antibiotics for UTIs and surgical intervention for cancer and urethral strictures. Home remedies for frequent urination include fluid modification, bladder retraining techniques, pelvic floor exercises, and the avoidance of citrus foods. Dietary changes, exercises, controlling blood pressure and sugar levels, and avoiding painkillers can all help prevent kidney disease. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. If you are suffering from kidney disease, you need to modify your diet, which helps fight the damage present there. These include strawberries, red bell peppers, low-phosphorus cheese, pomegranates, blueberries, avocados, tofu, fish, root vegetables, broccoli, beans, etc. For more details, you can watch the video on the screen. Here, we share the top 6 superfoods to heal kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed,